Hello everyone, welcome to CAPSA. Today's topic is about lung volume and capacities. Today we will be exploring the different amount of air your lungs can hold during various phases of breathing and why understanding this measurement is so important for your health. Let's begin by defining what we mean by lung volume. So lung volume, simply put, that it can refers to various amounts of air that your lungs can hold at different points in your breathing cycle. Think of it like a set of measuring cups for your lungs. These measurements are incredibly important because they help the doctors to assess how well your lungs are working, diagnose any breathing problems you might have, and see if the treatments are effective. So, lung volume are divided into four primary measurements, and these measurements do not overlap with each other. They are tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. Now, let's break down each of these starting from tidal volume. So, this is the amount of air you breathe in or out during a normal, relaxed breath. If you are just sitting quietly, the air you are moving in and out of your lungs is your tidal volume. On average, this is about 500 milliliters, which is roughly equivalent to a small bottle of water, and about 6 to 8 ml for every kilogram of your body weight. Next up to inspiratory reserve volume or IRV. Imagine you have just taken a normal breath in. The inspiratory reserve volume is the extra amount of air you can still inhale if you try to breathe in as much as you possibly can. It's the deep, satisfied breath you can take after a regular inhale. On average, this is about 3000 ml or about 6 times your normal tidal volume. The exact amount can vary from person to person based on things like their age, sex, and to fit how fit they are. Then we have the expiratory reserve volume or ERV. This is similar to IRV but for exhaling. After a normal exhale, the expiratory reserve volume is the additional air you can force out of your lungs if you push all the air out as much as you possibly can. So this extra air you can expel usually average around 1100 ml. Finally, there is residual volume or RV. This is the amount of air that always stays in your lungs even after you have exhaled as much as you can possibly. So you cannot breathe this air out. It's like the air that's always in a balloon, even when it looks deflated. Because you cannot exhale it, and residual volume cannot be measured directly using a common lung function test called spirometry. On average, the residual volume is about 1200 ml. Now that we have covered the individual lung volume, let's talk about lung capacities. So lung capacities are simply combinations of two or more of these individual lung volumes. They give us a bigger picture of how your lungs functions. We have four main lung capacities: inspiratory capacity IC, functional residual capacity FRC, vital capacity VC, forced vital capacity FVC, and total lung capacity or TLC. So let's look at each one. Inspiratory capacity or IC represents the total amount of air you can inhale after a normal exhalation. It's calculated by adding your tidal volume and your inspiratory reserve volume together. So IC equal to TV plus IRV. On average, this capacity is about 3500 ml. Next, we have the functional residual capacity or FRC. This is the amount of air remaining in your lungs after a normal relaxed exhalation. It includes the air you could still push out if you tried. So ERV, and the air that always stays in your lungs, that is RV. So FRC equal to ERV plus RV. The average functional residual capacity is around 2300 ml. Then there is vital capacity or VC, which is sometimes called as forced vital capacity. This is a very important measurement because it tells us the maximum amount of air you can forcefully exhale after taking the deepest possible breath you can. It's the total amount of usable air your lungs can move. To calculate it, you add your inspiratory reserve volume, IRV, your tidal volume, and your expiratory reserve volume. So VC equal to IRV plus TV plus ERV. The average vital capacity is about 4600 ml, though this can vary with age, sex, and even your height. Finally, we have total lung capacities or TLC. This is the grand total representing the maximum amount of air your lungs can possibly hold at any given time. It's the sum of all four primary lung volume like inspiratory reserve volume, tidal volume, expiratory reserve volume, and residual volume. In other words, TLC equal to IRV plus TV, ERV plus RV. On the average, the adult's total lung capacity is about 6000 ml. To measure these important volumes and capacities, doctors use several techniques. So, spirometry is a common and straightforward test where you can breathe into a machine. It's excellent for measuring tidal volume, inspiratory reserve volume, expiratory reserve volume, vital capacity, and forced vital capacity. However, because residual volume cannot exceed, spirometry cannot measure it directly. For measurement involves residual volume like functional residual volume and total lung capacity. Other methods are used. One such method is helium dilution technique, which helps in measuring FRC, RV, and TLC. For most accurate measurements of functional residual capacity and residual volume, a technique called body plethysmography that is often used. This involves sitting in a sealed chamber while breathing, and it provides a very precise measurement. Now let's take a look at the spirometry graph on the screen. This graph visually represents the different lung volumes we have discussed. So the wavy lines in the middle represents normal quiet breathing, and the volume of air in this section is your tidal volume. When you take a deep breath in, the curve goes way up, showing your inspiratory reserve volume, which is the extra air you can inhale above your normal breath. Conversely, when you forcefully exhale beyond a normal breath, the curve dips down, illustrating your expiratory reserve volume. The entire distance from the peak of the maximal inhalation to the trough of a maximal exhalation, encompassing the inspiratory reserve volume, tidal volume, and the expiratory reserve volume. So, which represents your vital capacity. And finally, even after a maximal exhalation, there is always some air left in your lungs, which is shown at the very bottom of the graph as residual volume. So this graph is a powerful tool that helps healthcare professionals quickly visualize and understand a patient's lung function. Thank you for your attention. I hope this lecture has made the concepts of lung volumes, capacities clearer and highlighted their importance in understanding respiratory health. Before we conclude, if you found this information helpful and easy to understand, please take a moment to like this video and subscribe to our channel. Your support means a lot to us and helps us create more informative content.